Now, today we will be dealing with some of the important image-based questions asked from general medicine. Now, these questions are highly to be repeated in your future examinations as well. So, just the topic of concern today is medicine. Now, going to the first question, I will just be magnifying the question and the diagram, the image. The question number one, it states that a 44-year-old is working in some industry. The nature of the industry is not mentioned. Pathology shows a picture as revealed in the figure below and most likely has. So, first of all, we have to concentrate on the figure, and the figure shows a macrophage over here and a cold macule over here. So, the options now given are byssinosis, berylliosis, silicosis, and anthraconosis. Now, so we have got a figure which shows a macrophage, which shows a cold macule, and the answer has to be anthracosis. We know people who just work in the coal industry, and there's a lot of accumulation of the coal in over a period of time or a period of years, and then there is this disease which is anthracosis because the coal macule would be a feature seen in anthracosis. So over here, the byssinosis would be with the exposure to the cotton dust. The berylliosis, somebody working in industry wherein you are exposed to beryllium salts, and silicosis wherein you have got an exposure to silica. Now, silicosis, as you are aware, is an important topic, and it has been repeated as well as along with byssinosis. So these four options are to be studied well along in, I mean to say, pulmonology. So the answer over here is anthracosis, and this you have to remember that anthracosis is associated with cold macule. I will not go to the other points which favor the diagnosis of anthracosis because they are not given in the question itself. So that diagram simply points to the answer, and your answer is option D, which is anthracosis. So that's important. Now, going to some other question over here, you can have a question which has been asked many a times. A 53-year-old patient had breathing problems. Question number three. He was having some undocumented illness in the past. Chest X-ray CXR was done, which is shown below. The most likely diagnosis is, so a patient is 53 years old, has breathing problem, and has some undocumented illness in the past. The most likely diagnosis. So over here, you can have a look over here. So if you have a look at enlarge this figure, you can be seeing over here, over here, over here. These are shadows, and these are large shadows which are having, these are ball-like shadows within the chest radiograph. And over here, the options given are miliary tuberculosis, cannonball metastasis, sarcoid lesions, and lung cancer primary. Now over here, if you have a look at this, the miliary tuberculosis would be a widespread form of tuberculosis in which the lung tissue, if this is the lung tissue would be having millet seed appearance, but the lesions will not be, I mean to say, as big as over here. So these are big lesions over here. And miliary tuberculosis, it would not be an option because it would be a fine dotted appearance of the lung. Now, sarcoid lesions, you know the sarcoidosis, which is a granulomatous condition and characterized by the presence of non-KZT granules. It would usually present with bilateral hilar lymphadenopathy. So here it is not the hyla, which are the hyla are free. So you can see the hyla are free. There is no hilar lymphadenopathy, which is characteristic feature of sarcoidosis. Also, there is no other history indicating history of sarcoidosis in the past. Now, lung cancer primary would present as a solitary lesion. So it could be present in the upper lung zone, the mid lung zone, or the lower lung zone, and there will be irregular cavity. But over here, there's nothing of that sort. So we are left with the option B, cannonball metastasis. Cannonball metastasis, you remember this picture, and over here, the picture would be just resembling this. I mean to say, it would be just, I will clear the fields, and you will see that this clear film shows a cannonball metastasis in which the lung fields are studied with ball-like lesions, small ball-like lesions within the parenchyma of the lung. And especially there is one cancer, which is the renal cell carcinoma, which presents with cannonball metastasis within the lungs. So this is the cannonball metastasis in the lungs, and I have here shown and documented the association of cannonball metastasis in association with RCC, which is the most common, and choriocarcinoma, especially in case of females. And it is a result of blood-borne spread, which is seen in many cases. So this is the way questions are answered. Now, in addition, we have got this question number 12, wherein a 12-year-old male presents fever and severe pain in the limb. Radiography shown and antibodies CD20 and MIC2 are present. Most likely lesion is. So over here, this is a lesion which is shown over here: tuberculoma, sarcoma, osteoclastoma, myeloma. Over here, you have to remember that the young boy presents with the features similar to osteomyelitis, and you have to remember that the clinical case of osteomyelitis resembles Ewing sarcoma, and Ewing sarcoma is characterized by the presence of CD99 and MIC2. So that is very important. So it is the presence of MIC2 and CD99 which are resembling Ewing sarcoma in the diagram. So this is how we answer the questions. So these are the types of questions you are asked and how we have to reply. Thanks a lot.